daddy.
Hello, my name is Maryam Adebola-Salami, a proud advocate for maternal, newborn and child health in Africa and a passionate project leader with over a decade experience driving community-centered healthcare solutions, particularly through our Project UWAR. By mobilizing partnerships and sponsorships to supply clinical-grade vetting kits, train and educate vet attendants, create community-wide awareness on vaccinations and family planning, develop clear communication materials that ensure safer deliveries and healthier newborns. Participating in the One Young World Global Health Academy has been very transformative. The model on the maternal newborn child health deepened my understanding of the systemic barriers affecting women and children, not only in Nigeria but across the African continent, from the inadequate health infrastructures to sociocultural stigmatization, religious beliefs that cause spotlighted challenges that I've long seen but now better contextualized on a global scale. It affirmed the importance of strategic collaborations between governments and international bodies and communities in saving lives. I was especially encouraged to see how aligned our work at Project UWAR is with proven global strategies, like deploying skilled vet attendants and improving access to emergency obstetric care. These have strengthened my resolve to continue to advocate for equity-driven healthcare systems across Africa. Other key takeaways has been including and adopting innovation and technology to accelerate change, like the communication materials that we use, leading through action and not just words, like just publicizing what we do, but actually going into these communities to further create the awareness and using evidence-based interventions for our work. My journey is rooted in action. At Mobaby Care, we launched Project UWAR, a maternal care initiative that began in 2022 in northern Nigeria and expanded over 200 communities up until 2024. We provided clinical aid and prenatal kits to more than 30,000 women, tackling high maternal death rates, and collaborated with local health centers, traditional vet attendants, and community influencers to promote safer family-based deliveries. Through partnerships with Access Bank, USA, Nigeria, and women-led coalitions, we've also supported equitable vaccine uptake, breastfeeding education, and access to family planning, areas that remain under-addressed and contributes to maternal and newborn deaths. It's interesting to know that other under-addressed situations that lead to maternal and newborn deaths like malaria, polio, and family planning were addressed in the academy, which also leads me to one of the most powerful lessons that I learned, which is that policies are critical, community ownership sustains change. This course reaffirmed that, and that's the art of my leadership going forward, empowering women to lead their own health outcomes. I'm leaving this course with a renewed sense of purpose and actionable insights. I intend to scale integrated community health educations and mobilize prenatal outreach into a more underserved area across Africa, not just relenting in Nigeria alone. We'll also share our proven fundraising and outreach models with other grassroots initiatives, because this work cannot be done by just us. With a background in project management, supply chain, and healthcare logistics, I'm equipped to drive innovations, whether through data-driven tools for maternal health or stronger cross-border collaborations for immunizations and family planning. Attending the 2025 One Young World Summit would amplify my voice, connect me with fellow change makers, and accelerate my work at the intersection of technology, policy, and grassroots healthcare. My story is one of passion, proof, and purpose. It's my last chance to be able to contribute on a global platform like One Young World to represent Nigeria, Africa, and every woman whose right to safe motherhood has been overlooked for too long. As a mother of three, I can testify and I understand the pain it can mean for someone to have access and others not to have access. I understand the life-changing interventions that I have privy to because of my access to good healthcare. Other women deserve this too. Let's create a world where giving a life doesn't have to become ending another one's life, and every child gets a healthy start. Thank you.